It is with great honor that I stand before you to present today's keynote speaker, Dr. Martin Seligman. Dr. Seligman is an active psychologist, researcher, educator, advocate, and author. Since the late 90s, Seligman has been an avid promoter within the scientific community for the field of positive psychology. In fact, he is referred to by some as the father of positive psychology. This title and pursuit came after a significant change in Seligman's research career, which previously included studying the theory of learned helplessness, a very popular theory among scientific and clinical psychologists. One might say Seligman went from seeing the glass half empty to seeing it half full. There is some truth to this, as Seligman disclosed an incident with his daughter that spawned his epiphany. Seligman shared that his daughter told him that since he had worked so hard to stop whining, he too could stop being so grumpy. Seligman has since devoted his time and energy into studying the components of happiness, optimism, resiliency, and the meaningful life. Seligman's accolades set a precedence not only for the field of psychology but for all social sciences and beyond. Seligman received his A.B. from Princeton University summa cum laude in 1964. He then earned a Ph.D. from the University of Pennsylvania in 1967. He has received numerous honorary doctorates, including from Sweden, Spain, and London universities. Further, Seligman has written more than 275 scholarly publications and over 20 books. He was also the 31st most cited psychologist in the 20th century. Perhaps one of Seligman's most influential and notable publication was the Consumer Reports, which looked at the effectiveness of psychotherapy. The primary results of his study found that treatment by a mental health professional usually worked, that long-term therapy produced more improvement than short-term therapy, that no differences were found between psychotherapy alone and psychotherapy plus medication for any disorder, also that no specific modality of psychotherapy did any better than any other for any problem, and that respondents whose choice of therapist or duration of care was limited by their insurance coverage did worse. These findings have had a profound ramification for psychotherapy and consumers of psychotherapy. Of further consideration, Seligman served as the president of APA beginning in 1998, with major initiatives including the integration of science and practice, prevention, resiliency, and positive psychology. Seligman currently serves as the director of the Penn Positive Psychology Center and Zellerbach Family Professor of Psychology in the Penn Department of Psychology. He is also the director of the Penn Master of Applied Positive Psychology program. Prior to that, he spent 14 years as the director of the Clinical Training Program at the University of Pennsylvania's Department of Psychology. Also, Seligman currently serves as the founding editor-in-chief of the journal Prevention and Treatment. Seligman's contributions to the science and practice of psychology, especially positive psychology, have been significant to say the least. It is with genuine pleasure that I welcome Dr. Seligman and turn the time over to him.